It's a good day. Okay, so a lot of people are starting to make the transition back into the workplace, physically going back into the building after working from home for several months. And a lot of times that causes a little extra anxiety on top of the already built-in anxiety because we're in the middle of a pandemic. So we've got Dr. Jaime Salas-Rushford with us this morning talking about how to make that transition. Now, you are very, very close to what is happening with the pandemic and traveling and such because you're going between Puerto Rico and Coney Island to help people who have been affected by COVID-19, correct?
Yeah, I was a volunteer in New York City. I did train over there, so New York is my second home. So I have to put my little grain of salt as much as I can to help my fellow New Yorkers and Puerto Ricans alike. They're over there living.
Absolutely. Okay, so let's talk about making those transitions because things are different. You know, when you come back into the workplace, you are used to just walking up and opening doors and going to the bathroom and walking down the hallway, having lunch wherever you want. Things have had to be different, right?
So everything changed. Like our life is post-COVID and after COVID, before COVID.
Right.
Some of us that got to live before COVID, you know, went out and about and had a lot of things. It doesn't necessarily have to be worse now. It just has to be more conscious. What I tell people is now you need to be conscious for your neighbors. Like we have to come as a world, as a community to help each other. Things so significant, you know, so simple as wearing a mask can actually, in a workplace, anywhere, can prevent the spread or actually catching it. So little things like this in the workplace are basic. We need to do very little things very well rather than doing many, many things unwell. You know what I mean?
Okay. Okay. Now, what are some of the things that you would say that people really need to be paying attention to? Because, for example, you have worked in these basically tent hospitals that we've got pictures from in Coney Island. So, you know, your work environment is a lot different than the average person who maybe works in with cubicles and things like that. But what are some of the major things that we need to be paying attention to?
So basically, I'm going to tell you what I do. Like we become hyper vigilant. So we go in, wash your hands, wear a mask, you know, surgical mask and so forth. And what you want to do is be conscious of what you're feeling as a person, meaning if you have a little fever, feel unwell, you need to raise the flag and then inquire more. It's not anymore that you got a fever for a day and that's about it. You got the flu or the cold for a day. Now you really have to be more conscious of what's happening in your body and what's happening with people around you. So it's not about just walking in, being an individual. It's about being part of the community. So what you need to do is what's going on in your body. If you feel unwell, if you feel things are not you, see what else is going on and get some help, some help from a healthcare provider. Also, you know, again, wear your mask, wear your distance. If you're somebody who's unwell, you know, you can actually approach a person, keep your distance, ask them, do you feel good, okay? You feel okay? No, I didn't feel that well last night, so let's get you some help. This is about taking care of yourself and taking care of others that are next to you. And I think those little things, well, if you follow those strict guidelines, are going to make a world of difference in not spreading the disease and actually containing it.
Okay, being more conscious. All right, Dr. Salas-Rushford, we appreciate your time this morning. We hope that you are being safe. I know that you're being safe, but I hope that you are well, and especially with your travels back and forth. And thank you so much for what you're doing on the front lines. We appreciate that.
Thank you so much.
All right, take care. All right, Code, back to you.